I'm here with Doctor Kellianne Arnella. So my name is Pat. I'm doing this live so we can get information on OT. It's kind of a casual thing, but I'll have Dr. Kellianne, introduce herself.
Hello, everyone. I am Kellianne Arnella. I'm an occupational therapist. I've been in OT for the past 15 years, working in neuro rehab pretty exclusively. I am, you know, passionate about what I do. I love sharing what I do. But as an OT for this amount of time, I've realized that a lot of our patients or a lot of people who could benefit from neuro rehab sometimes don't even know that it exists. So this is an important aspect of my, career as we go forward. Um, and I'm happy to share it with everybody.
Okay, great. You know what? I'm having some audio issues.
Okay.
Could you say something again? You know what? Yeah, it's still kind of so weird. Okay, but yeah, okay, well, the first question, I'm just gonna go ahead and ask the first question. So do you have a recommendation for survivors to maximize their time with their occupational therapist?
Yeah, that's a great question. So, maximizing time with your occupational therapist. So, I think that as healthcare has changed and it's continuing to change, the amount of time that we get with patients, especially in outpatient, is getting less and less. So it really is important to maximize the time that you have, especially in that type of a facility or in that environment. So I recommend really digging deep and kind of picking out goals that are meaningful to you, and being realistic with your goals. And your therapists can help you kind of pick out and better filter your goals to make sure that they are, meaningful to you, that they are achievable. And then when you set an appropriate goal, you can really tailor and craft um, your interventions to really address those specific goals. So I think that would be my first recommendation. And then the other one is really kind of adjusting your mindset. And this one's kind of hard to do. And I would say it's easier said than done. But adjusting it so that you know that you're putting in the work, likely more work outside of those therapy sessions than when you're in them. So really often tell patients that you should look at those weekly visits as a way to kind of check in with the therapist, adjust your treatment plan, and then really focusing on how you can build in the exercises to your programs while you're not in the sessions. So really think of it kind of in the reverse. How can you maximize what you're doing outside of sessions to maximize your time with your OT?
Yeah, all those answers. Like, a lot of things I learned, I think an important part is doing it outside as well and just taking what you learn, continue to do it
Yeah.
outside. Hey, Remedy, 743. Okay. As far as, from experience with stroke survivors, or what are some common, like, frustrations that they have?
Yeah, that's another really good question. And I will say, everybody's experience is different. So it's not always the same, frustration. People do get frustrated with how long it does take to recover. I have a very common conversation I have with people is that recovering from a neurological incident or condition is not the same as recovering from an orthopedic one. And what I mean by that is your brain is not a bone. It does not have the same healing time. So if you break a bone, you're often given this 6 to 8 week window. You have surgery, you're given a 6 to 8 week window for your tissues to heal, for you to start to feel better. when we're dealing with the brain, with neurology, right? Things do not occur that quickly. And there are certain things that we can't really predict how long it will take, if it will recover at all. And I think that feeling of the unknown of when will this get better, how much will this get better, is a big frustration. And it's a valid one too, because there's not a set map of when and how a person will recover. And so I think it's a big part of working with a therapist in therapy is really, managing that frustration. I think also another common frustration is like when I was talking about doing those exercises outside of therapy times. It, Oftentimes it's difficult to replicate what you're doing in a clinic at home or in a different environment. And that is another valid frustration. So, one thing I've tried to do with my patients is really dissect what's been going on or how they're trying to um, incorporate their exercises at home and what's getting in the way. What are the barriers, and how can we restructure what they're doing at home so that they can be more successful with it? Is at home and what's getting in
I
the way.
saw one
What
of
are
your
the
posts. You were working with a client you doing something outside in a hockey game or something. And I really.
Wait, what was that? That you cut off a little bit.
Oh, I saw one of your posts and you
Oh,
doing your therapy with a patient.
yeah, at the hockey game. So, there's a big gap in where we clinically treat our patients, right? So, like in an outpatient clinic in a hospital, and there's a major gap between that and their real life. Okay. Um, And when we do exercises, if you think of it like if you are so used to cooking in your kitchen and then you go to a different kitchen and try to cook, it's kind of confusing. You don't know where the spoons are, you don't know where the seasoning is, right? So things are going to feel more disjointed, more fumbled, right? So um, the beauty of occupational therapy is that we get on the same, we learn, we go into the field with the patient, we know, or we try to learn what the exact skills are needed for the task that they're having a difficult time with. So in my private practice, I really love to bring the patient into the community. And if I can't, I simulate it the best I can, so that they can experience and start to incorporate the exercises and the skills that we've worked on in the clinic in a real life environment. This helps the carryover and helps that skill stick much better than just treating it in a very contrived clinical environment. It's a really great thing for neuroplasticity too.
Oh, big.
Treating it in
So
very
your practice, your practice do that. What about at your?
at my other, like in my outpatient clinic.
Yeah.
Yeah, so I we do the best we can. We will mock up different parts of our clinic. We will create distractions that are similar to, we could take the hockey example. You can play music that's really similar to being in a hockey rink or any music. So incorporating that auditory stimuli that they have to work through. Um, we also might do, we incorporate different um, like multi-system loading, right? So and dual tasking. So being able to incorporate balance with a vision exercise, so that if you think about it, you're never really just using your eyes. You're never just using your vision. You're using so many other parts of your brain and your body at the same time. So it's important that we create programs and create exercises that match that skill recruitment to live your life. Create exercise that match
Sometimes I joke. Um, yeah.
those. Okay, here.
Okay. There. Yeah. A big one I'm working on right now is my vision. So I do a lot of practice, but when I go out, when I go outside, it's different. You know, outside environments to do. I noticed the more time in private, it does help in my outside. Yeah,
Yeah, that or too. Again, it's really like having that practice of you're in this safe, controlled environment where your brain can focus on what it's working on, which is absolutely necessary. Um, but bringing it to that next level to help you feel like you've accomplished more, like your brain can actually use the skill that you're working on, you really have to challenge it appropriately. Um, and not just by making the exercise more difficult, but by challenging your brain to focus on more than just your vision, right? So, um, definitely, that can help with the frustration that we were talking about earlier as well. I'm working on this, I've gotten so much stronger, but when I go do something in the community, I can't, right? And so that's where OT comes in, and really not only making things salient or making them meaningful and specific to the patient, but actually guiding them in the environments that they're working and that they're trying to use the skills that they're working on, or making them meaningful.
So, did you have any or anything that you would share?
Wait, tips for what?
Oh, you tips or anything?
For doing that?
See or anything from your experience? I don't. I'm sure.
Yeah, I think I look, again, I think it's hard to have like an open, um I think a lot of people expecting that the therapy is something that is passive, that they're with the therapist and then they'll be better. And that's really not true. I think it's important to look to your as a guide rather than a teacher, or like as a coach rather than a teacher, where they're going to help you. But the more you put in, I can't say the more you put in, the more you'll get out, right? But what I can say is the more you put in, the more you are likely to get out of the rehab that you do. Um, and also, being open to things that the therapist says. I'm planning on making a post that's about remediation versus compensation. And what that means is really like working on the skill itself, but also while you're doing that, using things that can help you compensate or help you um, do the activity a little bit more, because then that's going to encourage that active participation in a task. And I think it's that active participation and that active engagement in activities is what's going to help, help you a little bit more, not avoiding them.
I'm a
Engagement
believer
and
in what you're
activity.
saying as far as the more you put in, the more you get out. It might not be exactly like what you think, but I believe you a
Yeah.
lot. You're so focused on a goal, sometimes it's a lot more than that. It's a good reminder for me.
Yeah, I think a lot of times we have patients that come in and they have a really specific goal, and that's important. It's important to be hopeful, but your therapist should work with you to at least keep the goal in mind and break it down into something that's more digestible and achievable for you. So, I might have a goal of knitting again, but we have to start somewhere. And the small steps, understanding, I think that the small steps will lead to the whole staircase one day, is important. And sometimes we can't start with the whole staircase. We kind of have to do step by step in order to get where we want to go.
Thank you so much for your time today. I think we're 15 minutes. I feel like we should keep it around there. I actually
Yep.
got to.
Yeah, it's early by you. It's 7 in the morning.
Yeah, yeah. Hey, we should do this more often. I think I got a lot of value in our chat, and yeah, I would love to do it.
Yeah, absolutely.
Thank you so much, Dr. Kellianne. Have a good day.